Hello everyone. We're going to talk about something which is again very common. Just like heart attack, stroke is a major disability and major problem in the population. When a stroke happens, it doesn't not only actually affects the person itself, but the whole family gets affected. Especially if the person who got the stroke is the head of the household and the only source of earning, and this could be a major problem. Stroke, just like heart attack, happens for two major reasons. One of them is obviously if there is a blood clot which travels to the arteries of the brain itself, that can lead to stroke, or you have a bleed or small vessels or capillaries or other vessels get ruptured due to aneurysm or other issues that can lead to stroke as well. But certainly, before we go further, let's understand what is the stroke. This is how the stroke looks like in the CT scan. This is just a complicated X-ray of the brain itself. When you take a one X-ray, it's just like a one picture, but the CT scan take thousands of pictures, and then we can extrapolate and we can have a look at it, and you can see this is the area of the stroke, which is recently developed. This is how the arteries of the neck and head look like, and you can see this is coming from the aorta, the arch of the aorta, and then these are on the left side of the neck, and this is on the right side of the neck, and these vessels goes to the right and left arm respectively. This is what we call as the carotid arteries, and then you have in the back of the brain you have vertebral arteries, and then the whole head is actually covered with nice blood supply from four different sections, and then what we call as the circle of Willis, where all the branches of the brain actually comes and make a nice circle. So there's a two on the back of the neck and two on the front of the neck. The front neck arteries are quite big, and you can actually palpate. If you put your hand there, you can feel the pulsation of the artery up and down on both sides. And if you have a plaque either from the aorta or here, we're going to take a picture, look at picture in a moment, but certainly the area affected is this. Most of the time, either in the superficial part of the brain or the deeper part of the brain, and that can lead to stroke, which is a very debilitating disease. This is how as we looked at in one of the other videos, we looked at the atheroma or the plaque in the internal carotid artery, which actually you can see this the yellow stuff is all the plaque deposits there, and then the actual lumen becomes fairly small, and part of that plaque, once it gets broken, it travels up into the brain itself, and you can see it can, depending on where that clot goes, the function gets affected in a significant way. Depending on whether you're right-handed person or the left-handed person, sometimes the speech gets affected, and also the movement of the arm or legs get affected as well. So this is how the picture look like, and you can see again the plaque itself. This is one of the arteries, carotid arteries, and you can see a huge plaque there. Comparatively to this area, there is not much plaque, and you can see on this side, this is a damaged area. The blackish area is a damaged area, and this is how, just like heart, we can go into the arteries, the carotid arteries. You can see this is a small little wire with a little umbrella. The difference between heart and the brain is the heart is very forgiving, at least for most people. For in that case, small little plaque, although damage the heart as well, but certainly the brain is way more sensitive, and if you let any of these little plaque travel up there while doing the angioplasty, certainly it can cause a major problem. So that's why we use different baskets or something to trap the little clot there. So this is the wire, and then you have this slide actually shows the balloon. So you can balloon it, and you can stent the same way as you stent the heart arteries as well. And this is you can go even higher up in the main artery. There are different branches coming off. One of them is the big one is the middle cerebral artery. You can see there is a blockage there. This area should be as wide as, this is a normal vessel size, but then you see somebody pinched it. So this area is fairly pinched, and here you can see the stent itself has already been deployed. So this is quite complicated as well. There are people who are specializing in this kind of stenting as well. It's called a neuroendovascular specialist or neurointerventionist. So the most important thing to understand is what causes stroke. There are multiple causes for stroke, but certainly the most commons are the family history. And then you have diabetes, hypertension, high cholesterol are the big one. Cigarette smoking is also another big one. If you smoke, it's sooner or later it's going to get affected your arteries, whether it's the arteries of the heart, whether it's arteries of the legs or in the brain itself, and wherever those arteries are, depending on where the blockages are, the area distal to that or further down the stream is going to get affected. If that is brain, you're going to get a stroke. If that's a heart, you got to get a heart attack. Same kidney damage, or you will not be able to walk too much as well. So people who smoke certainly are putting themselves at a very, very high risk unnecessarily. It's a waste of money, and it's obviously it's going to affect sooner or later your arteries wherever they are. So the most important thing for these people is for somebody who got a stroke, the immediate thing is to get the CT scan. And once the CT scan is there and there is no significant bleed, then certainly the blood thinners like aspirin or clopidogrel or we call Plavix as well. So they can be used and they can be life-saving as well. And if you are in a center where they can go in and put a stent there, that's another huge blessing as well. So the most important part is once stroke happens, usually the recovery is within either 24 hours. If you are able to open up the vessel, the recovery is quite instant. But otherwise, when the stroke happens in the initial stages, there you can see, I hope you can appreciate, there is a fair bit of swelling or edema around the stroke area as well, and that can lead to a lot of loss of function as well, depending on the area affected. But as time passes by, the swelling gets better, and you actually can have some of the function starts to get better. So the recovery usually within first week or after at the most about a month or so. In that particular period of time, physical therapy or physiotherapy is essential. So this way, the hand, which if they cannot move, certainly you need to make an effort. Otherwise, the joints will get affected. They won't be able to move as effectively as it do, because anything which does not move is going to get rigid or fixed or frozen joints. Either it's a frozen shoulder or elbow. The same way for the knee as well. So physical therapy is essential. Taking your medication at right time is also essential. In one of the videos, we're going to show you exactly how to do physical therapy in a stroke patient. Thank you so much for your attention. Take care of yourself.